Here's a CT scan that was performed in a patient who was having back pain, and so there was concern for renal calculi. And I just wanted to point out an incidental finding in this. If we look at the right colon over here and we follow it down, we'll see here is our terminal ileum coming out here, and so we know that the appendix is going to come off of the cecum a little bit lower and on the same side as where the terminal ileum is entering into the colon. And this is our appendix right here, and we can see that there's this calcified structure at the base of the appendix, which ends up being an appendicolith. These are calcified fecaliths, and they can become impacted within the base of the appendix and can eventually predispose the appendix to become dilated and not be able to communicate with the rest of the cecum, and then become an area that can become inflamed and infected. In this particular case here, you can see that there's some gas within the appendix, so that suggests that there is communication between the cecum and the appendix itself, and that there's not inflammation going on, and there's no real periappendiceal inflammatory changes, and the patient wasn't presenting with right lower quadrant pain either, and so this was noted to be an incidental finding in this patient. But it's important to note because these patients do actually have a predisposition to developing acute appendicitis. And so this patient ended up presenting several months later with right lower quadrant pain. And when we scroll down in this particular CT scan, we can see here's our appendicolith, and here the appendix looks a lot more dilated. And now there's some inflammatory changes you can see surrounding the appendix here, and more distally as well. And so this patient ended up having appendicitis. So noting the presence of an appendicolith is important, not only in those cases where it's incidentally noted, but also in those cases where it looks like appendicitis, to make sure that the surgeons know to dig out that appendicolith, or maybe do a more proximal appendectomy to make sure that that appendicolith is removed.